viewers, this is Madhu and welcome to my channel, Twins Mama. This is a parenting and pregnancy related channel and I have already published many videos in my channel related to pregnancy, parenting and twin moments in Hindi. Today's video is about steroid injections in pregnancy. Though I have published a video on the same topic in Hindi in my channel already, but this video is specially for those viewers who have requested an English version of the same video. So yes, as a mom who has carried twins, I have myself taken these steroid injections in my pregnancy during the later stages of pregnancy when I had a probability of having preterm delivery. There are many queries related to the steroid injections in pregnancy. Many viewers had asked me whether these injections are given only for those females who are carrying twins, or whether these injections are harmful to the baby, or are there any chances of side effects. So please keep watching this video to the end. All your queries related to steroid injections in pregnancy will be resolved after watching this video. And provided you like the content of my video, please don't forget to subscribe to my channel. Steroid injections which are given during pregnancy are also called as antenatal steroid treatment. And if your OBG specialist doctor feels that there is a risk of you having a preterm delivery, only in that scenario you will be prescribed with a steroid injection or antenatal steroid treatment. Let me make it very clear that all those deliveries which happen before 37th week of gestation are considered as preterm deliveries. And preterm deliveries, as I have said in many of my videos, have a lot of complications. A child who is born prematurely or preterm has more difficulty in coping with the surroundings after the birth. And he or she may have to be admitted in the NICU or neonatal ICU for adjusting with the environment post-delivery. According to research studies, 50% of the babies who are born prematurely at 28th week of pregnancy or before that, and 1/3 of the babies who are born prior to 33rd week of pregnancy, they suffer from some kind of respiratory problems or breathing related issues, and most of them has to be admitted in the neonatal ICU for survival, and some even after being in the NICU for some or many days or months may not be able to survive. And all of this happens because a baby's lungs does not develop fully or does not mature enough when they are born preterm, and that is why these babies have a difficulty in breathing on their own. And I guess all of you have an idea that lungs are a vital component of the respiratory system. In case if they are not able to inflate and deflate properly, the entire mechanism becomes erroneous. Corticosteroid, this is the component which is present in these steroid injections. This is a synthetic form of a natural human hormone. So when the steroid injection is injected in a mother's body, it reaches the mother's blood, and via the placenta, it reaches the baby's blood and hence the lungs, and leads to a speedy development or maturation of the lungs. That is why even if the baby is born prematurely, there is an increased probability that the baby will not suffer from any kind of respiration related or breathing related issues. So if a pregnant woman has a probability because of any complication related to her pregnancy that she can have a preterm delivery, a course of steroid injection is prescribed by the OBG specialist. And usually only one course of injection is enough, wherein 2 injections are given at a gap of 24 hours, and mostly these are given within a week prior to the probable date of delivery. An analysis of 30 research studies spanning a total of 7,800 pregnant women, it concluded that if antenatal treatment utilizing steroid is given to women who have a probability of preterm delivery in their 25th to 33rd week of gestation, in between this period, it significantly enhances the development of lungs, thereby reducing the chances of the premature baby having difficulty in breathing, plus decrease risk of bleeding in the brain, and both these factors automatically reduces the mortality rates in these infants. And it has also been found that the bowel issues or digestion related problems in premature babies also decreases to a lot of extent when this kind of antenatal steroid treatment is given to the mother. Research studies have also found that antenatal steroid treatment decreases the probability of a premature baby having delayed milestones in the near future. So by now, I hope by this discussion I am able to give you a clear view that there are many advantages of these steroid treatments in pregnancy, provided the lady is diagnosed as having some risk for premature delivery. But now arises the question in mind whether this treatment is safe for both mother and baby. So yes, there is a lot of evidence which suggests that one course of steroid treatment, which as I have already told you, there are 2 injections given at a gap of 24 hours. This is absolutely safe for mother as well as the baby. No negative effects have been found in the literature related to this. Long-term studies that followed the development of these preterm babies till their childhood and adulthood, they also found that in the long term there was no developmental issues of these preterm babies. Hence, it can be considered as a safe treatment having substantial positive effects for the baby. But then it has been found that there are chances of having side effects if a woman receives more than one course of steroid treatments, and for them the babies might be smaller in size, that means having a lower birth weight, as well as the mother may have some kind of sleep disturbances after the baby's birth. So if you would like to know about my experience when I was carrying twins, there was a point that twin A had intrauterine growth retardation, and it was found that the blood flow towards the twin A was pretty less as compared to twin B, and there was a lot of difference between their estimated fetal weights as well. I have already shared my reports and all related to all my tests and scans and fetal heart rate as well as estimated fetal weights of my babies. So those who have seen those videos are aware of that. For my new viewers, I am saying this, that when the doctors found this, they suggested me that I had to go for a C-section at 35th week of my pregnancy. So before 2 days, I was injected with 1 shot of steroid injection, and after a gap of 24 hours, another shot was given, and these 2 injections made the 1 course of antenatal steroid treatment for me, and after a day my delivery was scheduled. If we go by statistics, preterm birth is one of the main causes of infant mortality. So if this steroid injection can decrease that infant mortality to some extent, I guess there is no harm in going for these injections, provided it is prescribed by your doctor for avoiding the complications of your baby after premature delivery. But if you are having an uncomplicated pregnancy, twins or singleton, doesn't matter, if you do not have a risk of any preterm delivery, then there is no need of taking these steroid injections during pregnancy. I hope my video could provide you some insight on this topic. For more such videos on pregnancy and parenting, keep watching my channel. Kindly subscribe and like, share and comment. Thank you so much. See you soon with another video.